Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on 3 articles on stroke published in February of 2025, 2 in the New England Journal of Medicine and 1 in the Lancet. The Lancet study, the OPENS-2 trial, the objective was to evaluate normobaric hyperoxia combined with endovascular therapy in acute ischemic stroke with large vessel occlusion. It was a multi-center, randomized, single-blind, sham-controlled trial. 282 patients, median age 65 years, 27% were female, all from the Chinese Han ethnicity. Primary outcome: it improved the modified Rankin scale score at 90 days. Median was 2 versus 3. Odds ratio was 1.65. P equals 0.018. Mortality: similar, 10% in the hyperoxia and 12% in the sham group. Conclusion: normobaric hyperoxia with endovascular therapy improved functional outcomes without increased safety concerns. The DISTAL trial, published in the New England Journal, assessed endovascular therapy versus medical care alone for medium and distal vessel occlusions. It was a multi-center, randomized trial, 543 patients, median age 77 years, 44% female. The primary outcome: there was no significant improvement in 90-day disability, p-value 0.5. Mortality was similar in both groups, 15.5% in the endovascular therapy group versus 14% in the medical care group. Safety: higher hemorrhage risk with endovascular therapy, 5.9% versus 2.6%. In the ESCAPE-MeVO trial, also published in the New England Journal of Medicine, compared endovascular therapy plus usual care versus usual care alone in medium vessel occlusions. It was a multi-center, randomized, open-label, blinded outcome. 530 patients, median age 74 years, 46% female. Primary outcome: no significant difference in good outcomes at 90 days. Mortality was higher in the endovascular therapy group, 13.3% versus 8.4%. Safety: endovascular therapy group had higher hemorrhagic risk, 5.4% versus 2.2%. Key insights: endovascular therapy showed limited or no significant benefit for medium and distal vessel occlusions. There was an increased risk of symptomatic intracranial hemorrhage, and mortality was observed with the endovascular therapy group, particularly in the ESCAPE-MeVO trial. The OPENS-2 trial demonstrated improved 90-day outcomes with normobaric hyperoxia combined with endovascular therapy in large vessel occlusion. Clinical practice may benefit from exploring neuroprotective strategies like hyperoxia for selective patient groups. Future research should refine endovascular therapy patient selection and assess adjunctive treatments to enhance outcomes.